So I'm going to do a video about my surgery, about the signs and symptoms that I experienced immediately preceding the surgery, my diagnosis, my hospital intake, my the diagnosis in the hospital, my surgery, my recovery in the hospital, my discharge, and then my full recovery from the surgery. This is all trying to be specific to the surgery itself. So basically, what happened is on November 30th, 2023, I started experiencing a lot of pain in my abdomen. It was accompanied by a huge volume of gas, more than I had ever experienced from eating some beans or something I shouldn't have. It was a lot. I took some Gas X a couple times, and it helped to alleviate the gas, but I was still experiencing a huge amount of pain. It felt like anytime food or anything would move through my system, that as soon as it got down to the uh, ileocecal valve, I could feel it like move through the ileocecal valve, and then a huge amount of pain, and then it would gradually go away. Did some research on Google, and this led me to believe that it was in proximity to my appendix. And so I thought, well, I've got to have appendicitis. 50-year-old male having appendicitis, not real common, but it does happen. Told my wife, hey, think I got appendicitis, I need to go to the doctor. Proceeded to go down to the urgent care. Went to the urgent care, they took me in, gave me a CT scan with contrast, and the radiologist came back probably about an hour and a half, 2 hours later. By this time, they had given me a bed in the hallway and given me some morphine to help alleviate my symptoms of pain. And the radiologist came back and said, hey, I'm not 100% sure that this is all appendicitis. It's the appendicitis, while it's inflamed, there appears to be a large amount of inflammation and thickening and a mass near the appendix in the intestines. I kind of wasn't sure what it was. The doctor was like, it's probably just appendicitis. I have a feeling that they all kind of knew, but they didn't want to drop the big C word until they had an affirmative diagnosis. At that point, I was admitted into the urgent care, and my wife went ahead and went home, got some sleep, came back the next morning. Took till about 3 o'clock that afternoon before they were able to get me a bed at the main hospital and transfer me down there. My wife drove me down to the main hospital in downtown Albuquerque. I walked in for admission, and they put me up in a hospital in the hallway. This is shortly, right around the same period that there was a hacker attack on Ardent Health Systems, and this resulted in one of the large hospital chains here in Albuquerque getting affected, and all the patients were getting transferred from Loveless to Presbyterian. So what that meant was I got to spend the night in the hallway. I don't know what kind of person would prevent people from receiving medical care, but these are people obviously with no morals, no ethics, and just the worst kind of evil in my imagination, preventing people that are having heart surgeries, cancer surgeries, all these things from healthcare from happening. If you want to blackmail somebody, blackmail the freaking oil companies, these huge retailers, whatever. But to attack a healthcare system, ugh, disgusting. Anyways, I spent the night in the hallway. Great care from all of the staff. I did kind of enjoy getting to hear all the talk at the workstations of the nurses, all the patients and everything that's going on. I kind of was privy to the inner workings of the hospital nursing staff there. That was interesting, kept me entertained since I didn't have a TV. Next morning, GI came in. That was on a Sunday. Or I'm sorry, on a Saturday. The GI doctors came in, kind of went over everything. They decided against doing a colonoscopy, and consulting with the surgeons, everybody knew I was going to have to get surgery of some type. They just weren't exactly sure what the end result was going to be. Would it just be a removal of my appendix? Would it be a whole colectomy? Would it be a partial colectomy? What would it be? My wife was there. My supervisor from work was there. The nurse was there. Another friend of mine was there. And the surgeon just kind of said, okay, well, we're pretty sure you have cancer. We're going to have to go in and do surgery, and we're probably going to remove your right ascending colon. This was the first that my wife had heard about this. All of this is going on while some visitor from another patient is talking on the phone, not 10 feet away, kind of disturbing the whole thing. And I was like, dude, can you go somewhere else and talk on the phone? But anyway, I digress. So that was when I first found out that I was going to be getting surgery. Shortly thereafter, once the hospital learned that I was going to be spending some time there, they went ahead and got me a room as soon as they could. I was moved into my own room on Saturday afternoon. Saturday morning at 7 o'clock in the morning, they took me downstairs and prepped me for surgery. Surgery took about 4 hours. During the process of the surgery, I received a full right colectomy. Basically what that means is they removed my entire ascending colon, including the ileocecal valve, the cecum, and the appendix, and they reattached my transverse colon to my ileum, which is my small intestine. The way that this affects me now is they took out the ileocecal valve, which is basically responsible for controlling, it's a sphincter muscle that's responsible for controlling the movement of food, or thyme I think they call it, between the small intestine and the large intestine. The ileum, the part of the small intestine right before the ileocecal valve, is responsible for the uptake of vitamin B12, for reassimilating the bile that your stomach and your liver secrete and your pancreas secrete gallbladder secrete during the digestive process. And it also helps with digestion of fat. So now I have a very difficult time eating fatty food, and I will probably suffer I need to be more careful of my nutritional uptake, because food doesn't stop at the ileocecal valve, it just moves right on through into the transverse colon. And so as my body adjusts, and as I adjust to my diet, I need to be careful of those kinds of things. Anyway, so during the course of the surgery, they discovered that a portion of my right colectomy my right ascending colon had scarification that was attaching it to the abdominal wall. So they went in, cut it off the abdominal wall, and basically extracted the whole ascending colon. Warning here, this picture of my ascending colon and what they extracted during surgery is pretty graphic. So what you can see on this picture here is I've got one arrow here pointing to the ileocecal valve, which I talked about earlier, and then I've got another one here pointing to what I think is a tumor. The doctors didn't tell me it's the tumor, but it sure does look like one. It matches the size, about 5 centimeters, that I saw in the surgical notes. That is my, I forget what it's called, the exact name of it. That's my cancer. They did manage to remove the vast majority of the cancer during the surgery, but during the pathology, they discovered, well, let me go back for a second. So they conducted the surgery, they brought me back upstairs, and I initiated recovery. Recovery went well. Everything was good. I was given morphine and Dilaudid for about 5 days. I tried to transition off of that as quickly as I could. I tried to extend the amount of time that I was taking it, as I did not want to become dependent in any way, shape, or form on these highly addictive medications. They ended up giving me Oxycodone, Oxycontin, which again, I tried to take as sparingly as possible. It's about pain management, trying not to let the pain get so severe that I'm suffering immense amounts of pain before I take the medication, but at the same time, not taking it so frequently that I develop any sort of addiction or dependency on these highly addictive medications. I experienced about 9 days of hospitalization 6 days after the surgery. They wanted me to have a BM prior to discharge from the hospital. I was having a lot of difficulty doing that because I wasn't willing to eat solid food. I was on a clear diet for 11 days. I lost 20 pounds during the course of this 11 days. I don't know how much the part they took out weighed, probably 2 or 3 pounds. I had to get another CT scan with a contrast that I consumed in order to make sure that I didn't have any blockage in my intestines. They took care of that well. That made me very nauseous, and that helped induce bowel movements, which made all the physicians feel better, and I could finally eat real food again, which I was very excited about. I promptly ate some chocolate pudding. Um, at about 9 days in, um, the general practitioner came in and told me, we received the pathology report. This is on December 9th, and they got all your cancer. I had a hard time believing this just because the research I had done said that almost everybody that gets this kind of cancer or surgery has cancer. But yay, my wife, she bought it hook, line, and sinker. They sent me home, and I began my recovery from the surgery, thinking that's all I'm going to have to do. Well, that's what my wife thought. Anyways, about a week in, the doctor calls me again and says they updated the pathology report, that they did find cancer cells outside of the tumor, that I had a microperforation, that there was an abscess in proximity to my appendix, and that they did discover cancer cells in that abscess. This meant I was going to have to undergo chemotherapy, and that I probably still had cancer. That really kind of shocked my wife, and I would have rather not had any diagnosis than to have had a premature diagnosis, and to have set my wife up, my friends up, my family up, all with these false expectations that I was cancer free and that the surgery had gotten everything. I kind of had already resigned myself that I had cancer, that they probably got it, and that I was going to have to undergo chemo for at least 6 months. The type of tumor that I have is T3NO, which means that it has grown through the lining on the colon, but there is no discovery of cancer or in the lymph nodes surrounding the area. I had 17 lymph nodes, of those 0 had cancer in them. So what I have is a stage 2 colon cancer, which is much more moderate, much less advanced than many people that I've talked to, and much easier to treat than many other forms of cancer. I do feel that it was very close to going into stage 3, which would have quickly escalated into stage 4. So I consider myself very blessed that it did occur where it occurred, in close proximity to my appendix, which is what I believe caused the pain, was the growth of the abscess on the appendix. And that's what sent me to the urgent care, resulting in the discovery of my cancer. So that being said, the surgery, the recovery from the actual right colectomy went very well. I was probably bedridden for a total of about 2 to 3 weeks. I could get up, go to the restroom, but was hunched over. I would get up and try to walk around the yard, do things to start moving, movement helps with your bowel movements, that kind of thing, and also the healing process. But I did, I had to roll onto my right elbow, lift myself up, so it wasn't like I could just use my abdominal muscles to pull myself up. I did experience some like tinges of pain, these kinds of things in my abdomen. I do now have a large scar, probably about 8 inches long, goes right around my belly button, and it's fully healed. My healing went well, everything's good as far as my surgical recovery goes. So that's kind of how the surgery went, how my hospitalization went. Obviously, results are going to vary for different people. I've had a lot of opportunity, and I didn't realize how many people I know have had cancer, how many people I know have had loved ones that have had cancer. There is very differing degrees of cancer, how far they've metastasized. I'm very fortunate that during the course of the surgery, they discovered no metastasization. The cancer has not moved, as far as anybody knows yet, anywhere else in my body. I did go through another CT scan of my entire torso. That said that I did not have any indications of metastasis or tumor growth anywhere else. Did discover that I have a slightly enlarged thyroid, and I've got blood work done since then, and have discovered that I have low thyroid, whatever that hormone that comes out of there is. So now I'm going to get treated for that. Anyway, this all being said, I will do videos later on how this all affected my family, myself, my friends, and how the signs and symptoms that I missed prior to the surgery that I had prior to my diagnosis, I feel like there was a lot of things that were going on with me that I either attributed to old age, to my diet, all these things. So again, don't delay a colonoscopy. That would have discovered my cancer earlier on, and would have enabled me to get treated, to probably have not had to undergo surgery and not go through chemo, which is horrible. I go get my second cycle tomorrow, so really not looking forward to that, but it is what it is. I'm blessed to be alive, blessed to be in the situation that I'm in. I've experienced a ton of personal growth from this experience, and I'm really grateful for that. And I thought I was doing pretty good on personal growth ahead of this. This really expedited that entire process. I have a renewed appreciation for my life, renewed gratefulness for what I do have, for my friends, for my family, for my loved ones, the people in my life, the things in my life, how fortunate I am to be in the country that I am, to receive the medical care that I have, to have the insurance that I have. I am so much better off than so many other people, and I need to just demonstrate gratitude for everything that I've been given in my life, that I've earned in my life. Very, very fortunate in many regards. But anyway, that's the end of this video on my surgery. If you have any questions, put them in the comments, and I'll do my best to answer them. Mind you, I'm not a doctor, I'm just a guy.